We all want better health. But for those struggling with depression, addiction, suicidal thoughts, or mental health issues, you may feel alone in the fight. Luckily, help and hope are closer than you think. As a true community partner, our trained staff provides compassion, specialty care, and even the ability to serve you remotely in the safety of your home through our virtual telehealth services. Better days are ahead. We'll help you get there. Lakeside Behavioral Health System. Find out how we can help today.
So Ashley Ewald joined Tennessee Department of Mental Health and Substance Abuse Services in 2021 and works in the Office of Prevention. Her role in primary substance use prevention is to promote healthy behavior and reduce the onset of substance use by providing day-to-day oversight of evidence-based interventions to Tennessee's most vulnerable populations. She also collaborates with Vanderbilt University and the Evidence Based Practice Workgroup initiative to research and develop best practices for coalition substance use prevention. Her background includes harm reduction initiatives and SSP services, health and human performance, and community education. This is a very impressive fun fact for Ashley. My mother would be very impressed with this too. She has never got a speeding ticket. It's pretty impressive. Cate, Cate the Great from the state, as we say here in Memphis, currently serves as a program manager for the Tennessee Department of Mental Health and Substance Abuse Services, overseeing the Regional Overdose Prevention Specialist and Harm Reduction Program. In this role, she oversees Tennessee's largest harm reduction program, including training, education, and naloxone distribution. Prior to working for the state of Tennessee, Cate worked in community services in Arkansas, Chicago, and Nashville, including youth violence prevention, community health, and family support. She holds a Bachelor of Arts degree in International Studies from Georgia Southern and Master's in Social Service Administration from the University of Chicago. Her fun fact is she took a honeymoon in Peru. That's amazing. I don't even know where Peru is. Anyways, ladies and gentlemen, not wasting any more of the time, please give a warm Memphis welcome all the way from Nashville, Tennessee, Cate and Ashley. Real quick, can we get confirmation that everybody online can hear us? Welcome, University of South Florida students that are watching. We know you tuned in this morning. Thank you for being here. Can someone give me a signal that check 1, 2. Is this registering on the Zoom link? Butch, we good?
Wait, what?
So as the generous introduction from Jack said, Ashley and I work for the state prevention office. So we are excited to be here. Both Ashley and I come out of community-based services before we came into the state. So we're extremely excited to be with you all and to understand the work that you all do as critical to what the state can support. So we're going to talk today about what is happening in our office, and there's some opportunities for you to learn, to get some resources, to get involved in that. So a little bit of framing. The Tennessee Department of Mental Health and Substance Abuse Services, our mission is to creating collaborative pathways to resiliency, recovery, and independence. And so we see this primary prevention work as falling into that resiliency. The tertiary and overdose prevention work that I oversee falls into that resiliency and recovery piece. And then our vision as a state is a state in which resiliency, recovery, and independence, in which Tennesseans living with mental illness and substance use disorders thrive. So we got the technical stuff out of the way, the things they make us put on the slides, so we're good there. So our session for today, we're going to talk about a couple main points. So we're going to go over some state and local substance use data and trends. We are going to talk about how the state and the state-funded programs, like the coalitions, are utilizing data to advance the prevention initiatives at both the state and the local level. And then we'll also talk about prevention activities that are hosted around the state that you and your organization can participate in.
So on the prevention side in our office, when I think of prevention, there's always two components. There's the risk factors and the protective factors. And I feel like the last presenter, he spoke a lot about the risk factors and protective factors. So our goals are to reduce the bad while increasing the good. And risk factors can be thought of those things like the adverse childhood experiences, all types of abuse and neglect, parental substance use, loss of a parent or caregiver, social and cultural influences. And I feel like we spend a lot of time talking about reducing risk factors that we often don't think about what the protective factors are. The protective factors are things like social and emotional competence, supportive environment of parents, peers, caregivers, and nurturing and attachment. Our programs aim to focus on at least one of these components, and most often they incorporate both. So this is the prevention continuum of care. We use this to determine what levels of intervention are most appropriate for a given population. So on the universal prevention and promotional strategies, this is aimed at everybody in the community, young, old, and our coalitions primarily focus their prevention efforts on the universal prevention. So our coalitions like the Memphis Area Prevention, they do things like advocating for local policy changes, placing signage around the community, and even hosting events like this. The other agencies that we support are more for they provide more specialized program for the vulnerable populations. They serve higher risk individuals so that they can provide more of that specialized support. The indicated and selected populations are those who have either exhibited the behaviors of substance misuse or they have a higher than average vulnerability.
So as when we get into that indicated category there, what we're starting to see is people who have already exhibited that behavior. And so when we think about prevention of substance use, this is also where we start talking about tertiary prevention and harm reduction services. So that's what I'll be talking about today. So in case you're not familiar with that, harm reduction is really a growing field in this. It's been happening underground and in community-based organizations for a long time, but we're really seeing a much more a larger emphasis from agencies like the state who are doing this. And it really is about meeting people where they are, figuring out what is it that they need, not assuming that we know what they need, and really focusing on that quality of life. And so, as you know, Ashley will talk some more about the primary prevention components, and I'll follow up with some of that tertiary overdose harm reduction perspective. But it really is, there are evidence-based ways to do this. There are ways to meet people where they are, to empower them to do that. All with that focus on improving quality of life. You know, we want people to be happier, healthier, more resilient people. That's what prevention across the spectrum does. And this is another way to meet a different population in that prevention sphere.
So why are we here? Why is this important? This is the Alcohol, Tobacco, and Other Drugs Summit. So we do have to talk about alcohol. We do have to talk about tobacco data that we're seeing in the state. And one thing I really enjoy about working in this environment is that I don't want to subscribe to fear-based messaging. I'm not going to show you these stats to scare you or to think that alcohol's right around the corner about to get you. And it's more or less to to provide a context that these substances are powerful, they have an effect on your body and your decision-making skills, and that there needs to be a respect for the risks involved with engaging with these substances. Alcohol consumption is alcohol is the #1 drug-related emergency department visit. There's also other costs associated with excessive drinking that we don't even think about, like loss from workplace productivity, healthcare expenses, criminal justice expenses, motor vehicle crashes. Our coalitions and our providers, they focus on implementing evidence-based strategies to a multitude of factors that can influence someone's decision to initiate use. And tobacco, I mean, we all know excessive drinking is not good for you. We all know tobacco is not good for you. It remains the leading cause of preventable death and disease in the US and in Tennessee. Over 35% of cancer deaths in Tennessee are due to smoking. And there's also other risks involved that we don't think about, like fires caused by smoking. So some strategies that we've utilized on a macro level scale would be things like increasing taxation, reducing access to it, like smoking bans. But they recently came out with that T21 law. It changed the age to purchase tobacco products to 21. Research has shown that the age group 18 to 20 years living in a state with T21 policies are more likely to not start smoking.
So I'm going to provide a little bit of context for the stimulants, that other drug part of the ATOD conference. But in order to do that, I want to make sure we're kind of all on the same page about what substances we're talking about and what risks we're talking about. So stimulants, broadly speaking, are types of substances that speed up the messages traveling between the brain and the body, increasing mood, making you feel more energetic, more alert, things like that. And so those kind of fall into 3 categories. We talk about over-the-counter type substances, including caffeine, nicotine, pseudoephedrine that you use for like cold and allergy medication, prescription medications that treat things like ADHD, Adderall, Vyvanse, Concerta, things like that. There are also some prescription weight loss ones as well. And then when we start talking about those illicit substances, we're talking about cocaine, methamphetamine, and ecstasy. So briefly, because I want to talk about the difference between misuse, and then we'll talk about illicit substance use. So when we talk about prescription stimulants and the use of those for ADHD, what we're talking about is creating more dopamine and norepinephrine in the system that really increases the attention and concentration. Those are very useful for folks who have ADD, ADHD in order to be able to be successful. But the thing that I want you to leave with today is that long-term use of those, wording to use by your doctor, as prescribed to you, does not increase the vulnerability to a substance use over time. And then the other thing that I think often comes up with folks who are working with youth is, well, they're misusing those substances. So they're either taking medications for those that are prescribed to somebody else, or they're prescribed, but they're taking them differently than the way they were prescribed. And so what the research actually shows us is that those uses, those misuse, does not actually increase academic performance. So continuing those other protective factors of getting enough rest, good study skills, things like that. So we want to make sure that as we're talking about stimulants, while these prescription stimulants fall into that category, that we are not stigmatizing or discouraging folks who need those to use those. So now we'll kind of move into the illicit piece. So primarily what we're talking about here is methamphetamine, crystals, powders, pills, ingested, snorted, smoked, injected, and then just a little bit of context for use in Tennessee. So this is statewide data. About 1.5% of the population over 12 uses cocaine or uses methamphetamine. And then when we talk about cocaine, we're looking at powder, crack, cocaine, bricks, things like that, injected, typically more with cocaine and smoked. Being crack cocaine with a past year use of over 12 Tennesseans, around 1.2%. So now that we're kind of on the page about what I'm talking about, I want to talk a little bit about the overdose epidemic. So what we have historically seen is an opioid crisis. It started early on in terms of prescription medications. We see that shift into heroin, and now we're in this time period of synthetic opioids, most commonly fentanyl. You can also hear about nitazenes. Those are also illicit opioids. But the other piece that we're seeing that's really alarming is this polysubstance overdose. So an opioid and a stimulant together. And those are particularly dangerous, whether people know they're taking them together or not, because of the stress that it puts on the body. So a little bit of data to frame that up. So if you can see from 2017, and this is all Tennessee data for fatal overdoses. And remember that not all overdoses are fatal, but these are looking at fatal overdoses. So that blue line shows us that in, make sure I'm looking at the right side, 587 overdose deaths in 2017 involved a stimulant. When we look at 2021, which is the most recent fatal data that's available for the state, we're looking at over 2,000. So that's a very dramatic increase in overdose deaths involving stimulants. And going back to this is mostly illicit stimulants. We're not talking about the involvement of large numbers of Adderall or things like that. If there is Adderall involved, usually it's in combination with these illicit substances as well. So that one's there twice. This is the old version of my slides. That's okay. So some data trends to just kind of call your attention to. This is also state level. Is that the rates of fatal overdose involving cocaine are 5 times higher among Black Tennesseans than white Tennesseans. And then rates of those fatal overdoses involving what is called psychostimulants with abuse potential, which is primarily methamphetamine. There's smaller categories in there, but that's how the epidemiologists capture this data, are just 2 times as high for white Tennesseans and Black Tennesseans, which you see as a pretty significant race disparity in that data. Other data points that I think are important to note is historically overdose deaths have been most common among men and white Tennesseans. And while that's still the largest group of them, we're seeing much higher increases in both women and people of color dying of fatal overdoses. And then the other data point that I think is worth mentioning is what we're seeing in terms of overdose deaths is primarily individuals between the ages of 25 and 44. So 1 in 2 fatal overdoses is in that age group. So, let's look at some Shelby County data. And so what you'll see here is Tennessee data at the top, Shelby County on the bottom. Just for reference, Shelby County has about 10% of the state's overall population, but 15% of all drug overdose deaths. So higher than kind of proportional there. And then in terms of the involvement of stimulants is at 16% of that. And so we're seeing, okay, yeah, stimulants are a higher risk and vulnerability here. This is the part that I think is really interesting in terms of thinking about Shelby County is 1 in 3 overdose deaths involving cocaine happened here in Shelby County. The other 2/3 happen in all other 94 counties. So you see a much different proportion of deaths involving cocaine here in Shelby County. And a lot lower percentage of that involving methamphetamine, and then the involving opioids and stimulants together, comparable to these other ones. So I'm going to turn it over to Ashley to talk about some of our young folks.
Y'all, I love data. So the TN Together survey is a survey that the state created. So there's 96 counties in Tennessee. We fund 46 of them. How can we measure if our programs are even working? Because this county may have this survey, that county may have that survey. They may have different variables and age groups that they measure. So we had this brilliant idea to come up with the TN Together survey. So the TN Together survey has a list of measurements that can bring in the data that we need to identify the problem and to find strategies to fit the solution. It's administered every 2 years. We survey 8th, 10th, and 12th graders, and in the last administration, we had 184 schools in 34 counties. So these are the points that our survey measures. And these questions, They capture the root causes of the factors influencing a student's motivation to initiate use, which could be access to substance. It could be if they think there's a risk in using these substances, the awareness of the consequences. This survey not only gathers information on which substances are most popular, but also the motivations behind that. Okay, this question's for you guys. Raise your hand if you think the most reported substance used on the last administration of the Tan Together survey was vaping. Who thinks vaping was the most popular one? All right, we got some people. Who thinks that methamphetamines was the most popular one? All right, we got some people. Who thinks alcohol was the most? Oh yeah, okay. Some of y'all know your counties. And then prescription drugs. Who thinks this one was the most reported? All right, all right. Survey says it's alcohol. And some of y'all obviously are not going to be surprised. Some of you will be surprised to see this. But the Tan Together survey is super cool because not only does it measure the substance, the respective substance and the reported lifetime use, but it also has the age of initiation. So for alcohol, we can see that it was mostly 13, almost 14 years when somebody initiated their first use. But what I find super interesting, if we look at methamphetamines, only 1% of TNU reported lifetime use. Age of initiation is 12. So what do we do with this? What do we do about it? Again, this is why data is important. If you think about Tennessee with our 96 counties and all of our funded coalitions, every community is different. Every community is unique. This is why we collect a baseline survey, the Tan Together survey, because it helps show us how we can best implement our programs and evaluate the effectiveness. So I'm going to give you guys a couple of examples of how we use the data and strategically implement programs to address the issues. So this graph shows the perceived risk of using the respective substances. Now, ideally, these would all be 100%. We want students to think that there is a high risk in using any of these. But from this, we can see that there's the lowest perceived risk with trying marijuana and then regular marijuana use. And then vaping had the next lowest perceived risk. So they don't think there's a lot of risk in trying these. So what do we do about it? We implement strategies to promote the perception of risk. It would be things like education, information materials, trainings, presentations, events like this. This graph shows the percent of students reporting a substance, the substance access. Is it easily accessible to get alcohol? Is it easily accessible to get cigarettes? Once again, we would hope that this would be 100%, that they would all think it's difficult to access these substances. However, students reported the greatest ease of access to vaping devices, but they felt that marijuana was the least easy to access. So some examples of strategies to reduce access would be things like count it, lock it, drop it with your medications. You know how much you have, having it in a safe, locked location so little hands can't reach it. The National Guard Counter Drug Task Force, they have their stashed away trailer. And it's really an interesting concept. They have this trailer that is made to look like a child's bedroom, and the intention is so that you can go through this bedroom so they can show you all the unsuspecting ways that you can hide and stash away their substances they may have. Another one is the drug take back day, which I'll tell you more about that later. But these are ways that we can reduce access to these substances for the youth. Now this one hits a little bit home for me. When I was growing up, We never had a talk in my family about the substance misuse and the dangers involved. It was the scare tactics of this is your brain on drugs, and it had a little fried egg on it. I don't know if y'all remember that, but this question asked the youth, have you communicated with your family about the dangers of prescription drug misuse? And have you communicated about alcohol, tobacco, and other drugs at least once? And the results are disappointing, but not surprising. So I know that Jared talked a lot about family structure, family communications, how the parent and caregiver are one of the most influential people in youth's lives. So SAMHSA came out with a campaign called Talk They Hear You. It is a comprehensive resource that helps parents and caregivers find ways to talk to their children about substance misuse. They have toolkits for hosting parent events, conversation guides, and conversation starters, because there is an extreme lack in communication around the risks and effects. Okay, so now we know the strategies, we know this problem, we know their strategies. So how do we get these programs and this information out into the community? So if you guys remember in the beginning of this presentation, that little half wheel, the continuum of care, who are we addressing? So although our programming can be universally implemented to all ages in all counties and all spectrums, we know that the brain is still developing until age 25. The most effective target for these strategies would be youth and young adults. By reducing the number of youth who use alcohol, drugs, and tobacco, we can reduce the number of individuals with chronic substance use disorders. What is it? An ounce of prevention is worth a pound of the cure. So this is our TPN, Tennessee Prevention Network overview. This is on that continuum of care. These are the folks who need just a little extra specialized care. The selected population, those who have a higher than average vulnerability to these behavioral conditions, and the indicated population, those who have already exhibited behaviors. These are some of our programs that are within the TPN network. We have the comprehensive alcohol, tobacco, and other drugs, the ATOD. The Nurses for Newborns, that's a really long acronym. We just call it Nurses for Newborns. But that one's really interesting because it's where nurses provide in-home visitations for infants at risk. We also have college campus initiatives designed to provide primary prevention services to college students. So this map, the blue shows the home office locations of our TPN agencies, and the gray shows their catchment areas. They're able to kind of flow between county borders and provide services in multiple counties. We have our evidence-based curriculum. All of our providers provide programs that are evidence-based. They have to be based in research, proven effective, and vetted before they're able to provide it to the community. So we have programs like thought and life skills, strengthening families, positive action, too good for drugs. These have all been proven methods to reduce substance use in youth and young adults. Oh, and some of the ones in Shelby County, we have Pyramid Recovery is one of our TPN agencies, Shelby County Schools, and University of Memphis. All right, John, this is the universal and promotional strategies on that little continuum of care. So the program goals for coalitions, universal prevention, again, kind of targeting that youth and young adult, but they are more county-based and provide services in the local communities. They act as essentially a central hub for overall substance use prevention. And the 5 substances we focus on are reducing binge drinking, tobacco use, non-medical prescription drug, marijuana, and stimulant use. So there we go. We have 46 funded coalitions in Tennessee. More than 75% of Tennesseans live in a county with a coalition. The Strategic Prevention Framework, or the SPIF wheel. If you're in public health, you've probably seen this. If you're a student in public health, you will hear this multiple times. It's an evidence-based planning process for preventing substance use and misuse. 5 steps offer a comprehensive process for addressing community issues that might influence a young person's decision to engage in use. This is what all of our coalitions revolve their action plans on, to efficiently address the specific problems that were gathered by the Team Together survey. So we're going to take a little deeper look at the implementation piece of this and how our providers are able to create effective programs. So within the implementation, there are 8 strategies to affect community change on a broad scale level. All of these strategies are really important, but I want to focus a little bit more on the environmental and social policy. That is the planning, policy, practice, or procedure change. This is the one that contributes to the most sustainable change and is necessary to enable other interventions. These other strategies help support the policy change. So a policy change might be to develop a public safety ordinance to reduce window signage, restrict the number of commercial retailer outlets, and even increase prices and taxes. This is the most efficient way to affect the given community.
So we've talked a lot about the ways in which the coalitions and the partners that we as a state agency fund, but don't worry, you guys have access to a lot of data. And so the next 2 slides are provided by our partners with the Tennessee Department of Health and the Office of Analytics and Informatics and Analytics, OIA. And so wanted to make sure that you all knew that those resources were available. They have a data dashboard that's there. It talks about fatal and non-fatal overdoses. You can sort it by county, by types of substances. So if you're interested in that sort of data, and there's a QR code on 2 slides. So those are there. You can also, they put out a various kinds of annual reports, fatal overdose, non-fatal overdose. There's a buprenorphine one, things like that. There's special reports. They're doing a great job putting out emerging drug trends. So there are briefs on there about nitazines, xylazines, and we'll continue to work with them there. So I'll go ahead and put this up. So if you're interested in looking at their resources for data that you can use in your work, or even just to get you to know your community better in a different way, that QR code will take it there. I will also say that email address is there. We have a great partnership with the Department of Health, and they are very interested in that communication between communities and data. So I encourage you, if you have questions on there, you're like, hey, I wonder about, or, we've even had experiences where community partners have said, hey, we're seeing more of this. What does the data show? And that really drives them to look more deeply into issues that you all are seeing. So I encourage you all to engage with that. So at this point, I think I've stalled long enough. So I'll move on to the next slide. If you need help with that, I'm happy to help you with that afterwards. So Ashley talked about the primary and secondary prevention. I'm going to move into the overdose prevention and harm reduction part of the work that happens through the state. So this is my shameless plug for the ropes, but the ropes are the regional overdose prevention specialists cover all 95 counties. We have them broken up into divisions across the state, and they are really the hub for our harm reduction projects throughout the state. And so what does that look like? I gave you kind of an introduction to it before, but I want to go more in depth on what does this mean and why is it so important for this work. So really focuses on being non-judgmental, focusing on quality of life. We see that behavioral change is an incremental process. I don't know about you, but the last time I tried to eat healthy, I did not go from junk food to health all in one day. Still working on that, but we recognize that those little baby steps along the way towards a healthier one are something that we need to celebrate. We also recognize that complex social factors are also kind of tied up in individuals and community substance use. And we really want to empower those who use substances to be the primary agents of reducing the harms of their substance use. This is not about paternalism. This is not about making somebody do things the way I want, but how is it that they can take charge of those? So the ropes do this harm reduction work or this tertiary prevention work. Briefly, they provide training and education. That is the primary focus on this. Serve as a point of contact for naloxone. You may know it as Narcan, but that is an overdose reversal medication for opioid overdoses. Respond for overdose spikes, clinic closures, things like that. They're the boots on the grounds for responding to those events. And then the other piece that I'll kind of talk today about is raising awareness and reducing the stigma of the overdose epidemic and available resources. So very briefly, I think the training is great. I also am the one that mostly developed it. So shameless plug there. If you've not taken a training with Josh or David here in Memphis, they are fabulous, very knowledgeable, very passionate. And they can do that for individuals. They do it in treatment groups, community organizations. If you've got a student organization, they'll come out and do that. Churches, really anybody and everybody that wants this information, they are available for that. Just a little bit of a, hey, this is kind of the scale that we're working on. So since 2017, October of 2017, when the TN Save a Life program started, that's the big umbrella that the ropes are under. We have distributed more than 440,000 units of naloxone, and we have reported more than 60,000 overdose reversals. We also assume that number to be much lower because, as you can guess, if someone has just recently overdosed, I guarantee the first thought is, I am not going to go into a form stack, fill out a form, and report that this just happened to the state. That's not how that works. So we assume that number to be much higher. So that gives you kind of a context of what is the state doing. But I also wanted to leave some information with you about what is it that you as an individual can do. So we talk a lot about the stigma of substance use, and we want to make sure that we're all continuing to do that. So what is stigma? Lots of definitions. It is, a person feeling or being seen as less than because of a real or perceived health status. Those are often things that we are conditioned for. These are not necessarily things that we're set out to be I want to be super stigmatizing. No, those are just things that we're enculturated in. And that we need to be intentional about doing it. I've been doing this work for several years, and there's still things that I have to catch myself saying or thinking. And again, that's that incremental approach to this. And why is it so important is that stigma can really reduce a person's willingness to seek out treatment, take other actions to reduce harm, ask for help. All of those things are so important for folks to be able to do. As providers or future providers, recognizing the important role that you have of creating non-stigmatizing environments for folks to receive care and treatment really impacts patient outcomes over the long haul. And then lastly, delayed treatment can cause additional harm to an individual. So there's a study done a couple of years ago that one stigmatized interaction with a medical provider delayed seeking other treatment for any kind of treatment 5 to 6 years. And in the age of fentanyl, that's the difference in life and death. So this is big stuff for us to be doing. So what do you do with that? A couple of things I think are important to frame up about kind of keeping in mind to reduce that stigma. So we talk about substance use falling on a continuum. So abstinence, low risk, chronic dependence, there's a whole lot in between. We're talking recreational use, we're talking substance misuse, things like that. But there's a wide range. It's not a black and white status. We also talk about relapse or return to use not being a moral failure. It's a chemical process in the brain. And for a lot of folks, it takes several times and a lot of skills and a lot of support to get there. And so we want to recognize that we want to stick with people through that process. If you, again, people who have, maybe you need to eat healthier, myself included. My doctor still tells me every time I go back, you need to eat healthier, you need to exercise more. That's also a recurrence of a chronic health condition. In the same way that returning to use can be a return to a chronic medical condition. And then we also want to be aware of that personal and unintentional bias, and then ACEs, trauma, all of that's tied up with that. So some concrete tools. So we really want to focus on this person first language. So we're not talking about a junkie or an addict. We are talking about a person who has a substance use disorder or a person who uses drugs. Other examples of this, so if you work in a treatment facility, which is what I did before I came, we talked about clean and dirty screens all the time. That was common language. That's really stigmatizing. We need to be talking about describing the behavior and the result, not imposing judgment with that. So we talk about substance detected or not detected in those screens. Other examples, this one's super hard for a lot of folks. We're not talking about clean and dirty needles. We're talking about sterile needles or unused syringes. Clean, dirty, those have so much power, so much judgment in that language. So that's another way to think about that. We're not talking about being clean. Again, wasn't that clean, dirty? There's a whole bunch of baggage that goes with that. So not using substances is a good way to talk about that instead. And then persons living in recovery. So we're not talking about an ex-addict. We're talking about where is that person and what is the quality of life that they are living in this moment. So those are a couple examples of ways that you can kind of take that back and work on that. Again, incremental change. Keep working on it. So this is also a great resource if you want to take out your phone and want stuff. But there are a couple of good resources. The In This Endemic Tennessee is a group based in the Department of Health, and they have put together a great language guidance document that covers not just substance use, but includes information about HIV, includes hepatitis, whole lot of great information. This one's a couple years old, and I know they're working on a revision for that now. Also, if you're looking for CME credits, NIDA also has a really good resource for that. So I hope those gives you some ideas and some like takeaways from today. You know, we talked about what the state is doing, what these organizations, but we really also want you all to leave knowing that what you do in, day in and day out and the work that you do also makes a difference and is a big part of this movement as well. Okay, so some other next steps we want to talk about. So there we have some community resources. So one of the projects that I oversee is some virtual trainings on some various topics. So we contract with Dr. Brian Windbigler. We got him connected when he was teaching at UT, and now he's doing research. But if you're interested in a fentanyl training, that is on Tuesday at 9:30. And then we're going to do a stimulant training on Tuesday, May 9th at 9:30. So those are links there. I encourage you to do those. They're free and virtual, so hop on for those. Okay. Jump back to take back.
Yeah, so Drug Take Back was that event that I mentioned earlier to reduce access to substances. It is in partnership with the DEA. They have one going on tomorrow. So if you are in Memphis and you want to participate, go in and support your local coalition. It is tomorrow from 10 to 2. And you can find other locations on the tntogether.com/takebackday.
I'll talk about some of the ones that are more related to overdose. So we are coming up on National Fentanyl Awareness Day. I think the coalition here is doing some work, as well as International Overdose Awareness Day that is in August. So encourage you all to seek out those opportunities to participate in those. Those tend to be very meaningful activities, whether they're kind of education focused or kind of community coming together. The other thing to mention is that the coalition is not the only one who can do these events. So I know in Nashville, for example, a lot of the treatment recovery centers do those days because a lot of their folks are overdose survivors or have lost someone. So these are ways to continue to put out this message, provide education, provide community, provide support with all of that. Some other resources. This is also a great time to take out your phone and take pictures of things. The tntogether.com website has a lot of great resources for families and communities who are interested in substance use and substance misuse prevention activities. Community resources for substance use treatment and recovery. The Tennessee Red Line is 24/7 call or text, and they'll help you figure out based on your insurance what treatment services are around. Find Help Now has recently been launched. I'm not sure kind of the scale they're operating at yet, but they're definitely working on that. But that's an online portal where you can kind of search based on what you're looking for in your areas as well. Making sure that folks who are at risk for substance use also are aware of the 988, the crisis in mental health. We know that those things go hand in hand for a lot of folks. If you're interested in getting involved in your coalition right here in Shelby County, we've got the Memphis Area Prevention, and that's there. If you're coming from another county, what I would suggest, rather than trying to get the URL, is go to tn.gov and searching Prevention Coalition, and then with the Regional Overdose Prevention Specialists. So those are the tertiary prevention folks as well. Okay. Actually, I'm going to talk about individual action.
Yeah, so what can you specifically as individuals do? You can participate in Drug Think Day. You can know the facts. You can look at yourself and do self-reflections on your personal bodies and do your own internal work on reducing that stigma. Having intentional exposures to the protective factors, reducing risk factors when you can, and just bearing in mind on the grand scheme, how little activities like putting away your medication, talking about substance misuse, these make a big impact in not only your individual lives, but in the health of the community.
So Ashley's talked about what you as an individual can do. If you're here on behalf of an organization or you're involved in community organizations, there are lots of ways for you all to join that as well. If you're not involved in the coalition, always our shameless plug for that. Schedule a training. The ropes are here for that. The coalition is here to provide information. That is what they are paid to do, to come out and do that. Partnering for events, inviting them if you've got a resource fair, or a town hall or things like that. Any ways that you all are gathering folks that can benefit from information, that is what they are there for. We talked about some of the annual events, so Fentanyl Awareness Day, International Overdose Awareness Day, and Drug Take Back Days are also great. And then also reach out if you are working on something. The coalitions are well connected, have lots of partners, and so there are lots of ways to get involved in this. We are all here as individuals, but we are part of communities across, our lives and different aspects of this. And so recognizing that you may be an integral part to getting other folks involved or connected with the resources that they need. So I will leave up our information. I'm Cate. This is Ashley. So we are always happy to talk with folks. We are excited to be here, excited for the work that you all are doing, and would love to communicate more with you.